Assalamualaikum. Now I would like to talk about skin, and I would describe some skin pathologies step by step. This is a picture of a skin. This is dermis, where there is blood vessels, nerve endings, connective tissue, and lymphatic vessels. And this is epidermis. And epidermis has mainly four layers: stratum basalis, stratum spinosum, granulosum, corneum. Stratum basalis, spinosum, granulosum, and stratum corneum. This is stratum basalis, and this area, look, this is the area of stratum spinosum, and in here there is a communication or connection between the keratinocyte, and this connection is called desmosome. This connection between the keratinocyte is called desmosome, and this connection indicates that this is stratum spinosum. And above that there are some granular area. Which is called stratum granulosum, and above it there is an area where there is anucleated cell. There is no cell. This is the area where there is no cell. It is called stratum corneum. So in skin, this is dermis, where there is nerve endings, where there is blood vessels, where there is lymphatics and connective tissue. This is stratum basalis or basal layer. This is the stem cell layer or regenerative layer. This is the stem cell or regenerative layer. This layer, this spinosum has some connection between the keratinocyte, which is called desmosome, and above it there is a granular layer which is called stratum granulosum, and above it there is a layer, anucleated cell layer, which is called stratum corneum. Okay, first, this is the picture of atopic dermatitis. Atopic dermatitis is a pruritic erythematous oozing rash and vesicles. Pruritic erythematous oozing rash with vesicles and edema. Usually this is the flexor surface. This is the flexor area. Flexor surface is atopic dermatitis or eczema. Atopic dermatitis. In atopic dermatitis, there are some characteristics, like in atopic dermatitis, it onset in first 2 years of life. It has a history of asthma or hay fever. It is associated with allergic rhinitis. It is associated with type 1 hypersensitivity. This is associated with type 1 hypersensitivity. And just this kind of presentation, that pruritus erythematous rash, pruritic erythematous oozing rash in the vesicles and edema, same type of presentation, but it happens due to some contact of the metals like nickel watch, under the surface of the nickel watch, like poison ivy, like arsenic, like nickel watch, or the drugs. If same presentation and you get this kind of history, it is contact dermatitis. So history is more important for diagnosing a disease. If you get a baby with 2 years of old, he has history of asthma or hay fever, first asthma or hay fever, it might be atopic dermatitis. But with a history of this contact, with a history of poison ivy, arsenic, or nickel or nickel watch, in that case you have to think about contact dermatitis. Some chemicals like detergents are responsible for contact dermatitis too. And in contact dermatitis, you need to discard the avoiding agents. You need to avoid the offending agent, removal of the offending agent, and you can give topical steroid. And the third, uh, and the next one, this is the picture of psoriasis. Psoriasis is a well circumscribed. This is well circumscribed salmon pink, well circumscribed salmon colored plaques, well circumscribed salmon plaques with silvery scale, salmon plaques with a silvery scale. It usually present in the extensor surface. This is the extensor surface, usually present in the extensor surface. Can you tell me where atopic dermatitis happen? Atopic dermatitis happen in the flexor surface, but psoriasis happen in the extensor surface. Psoriasis happen due to excessive keratinocyte production, and it is possible with HLA C. HLA, it is associated with HLA-C, and lesion often arise in the areas of trauma. And in here we have to think about this. In histology, there is acanthosis. There is acanthosis, that means epidermal hyperplasia. There is epidermal hyperplasia, which is known as acanthosis. And the next one is parakeratosis. This is the picture of parakeratosis. What does it mean? That means hyperkeratosis with retention of keratinocyte nuclei in the stratum corneum. In the stratum corneum, there is a retention of keratinocyte nuclei. There is retention of keratinocyte nuclei. It is called parakeratosis. And the third one is collection of the neutrophil in the stratum corneum, which is known as Monro microabscess. In Monro microabscess, there is a collection of neutrophil in the stratum corneum. There is, in Monro microabscess, this is the neutrophil collection, and it is known as Monro microabscess. This is parakeratosis, that means hyperkeratosis with retention. In here there is retention of the keratinocyte, which is known as parakeratosis. But if the neutrophil, if there is collection of neutrophil in the stratum corneum, then it is Monro microabscess. And finally, there is you will get a sign called Auspich sign, that means thinning of the epidermis above the elongated dermal papilla, resulting in bleeding when you scale is picked up. If you just touch here, if you just rub here, the underlying skin will come out, because there is thin epidermis, and you will see the bleeding spot underneath it, and this is known as Auspich sign. And as a treatment, you can give corticosteroid, you can give cyclophosphamide, you can give methotrexate, and you can give Tuva, that means UV light with Soralin. And the next one, this is the picture of xeroderma pigmentosa. I will describe about this later. This is the picture of cherry hemangioma. This is the picture of cherry hemangioma. This is the picture of cherry hemangioma. This is the picture of tinea corporis. This is the picture of tinea corporis. This is the picture of vitiligo. And this is a picture of hydra adenitis, suppurativa. This is the picture of staphylococcal scalded skin syndrome. This is the picture of tinea versicolor. There is versatile color tinea versicolor. Now, now I would like to, there is no picture about it, but I would like to describe about lichen planus. Lichen planus. In lichen planus, there is all the P. That means planar. That means planar to write it. That means planar to write it. That means planar to write it. Polygonal, planar to write it. Polygonal, purple papule, often with reticular white line on their surface. Often with reticular white line of the surface, it is known as Wickham stripe. This is known as Wickham stripe. So in lichen planus, all is polygonal, planar to write it. Polygonal, planar to write it. Purple papule, often with reticular white lines on their surface. This is known as Wickham stripe. It is commonly involved wrist, elbow, and oral mucosa. This is same wrist, elbow, and oral mucosa. Oral involvement manifests as Wickham stripe, and the histological picture you will get in the dermo-epidermal junction. In the dermo-epidermal junction, you will get the sawtooth appearance. In dermo-epidermal junction. So in lichen planus, you have to remember two things. One is all the P's, and the second one is in histology there is sawtooth appearance, and third one is it is associated with hepatitis C. So in lichen planus, the three things associated with hepatitis C, sawtooth appearance, hepatitis C, and there is Wickham stripe. Now, this is the picture of pemphigus vulgaris. This is the picture of pemphigus vulgaris, and this is the histological picture of pemphigus vulgaris. In pemphigus vulgaris, what happens in autoimmune destruction of the desmosome between the autoimmune destruction of desmosome between the keratinocyte. In here there is IgG. Pemphigus vulgaris is autoimmune destruction of desmosomes between keratinocytes. In pemphigus vulgaris, there is autoantibody production. There is production of IgG antibody against desmoglein. It's a type 2 hypersensitivity. In here, autoantibody production against desmoglein. IgG antibody production in desmoglein. This is the picture of pemphigus vulgaris, where there is involvement of the oral mucosa. In here there is the thing that you have to remember, that acantholysis means that means separation of the stratum spinosum. In here there is a separation of the stratum spinosum. This is dermis, this is epidermis, and the stratum spinosum is separated. Stratum spinosum is separated, and it is known as acantholysis. And the second one is, this is a tombstone appearance. That means basal layer cells remain attached with the basement membrane. This is the basal layer cell which remain attached with the basement membrane by hemidesmosome. It is known as tombstone appearance. Tombstone appearance. So first of all, there is acantholysis. There is, that means separation of the stratum spinosum. Separation of the stratum spinosum between separation of the stratum spinosum keratinosum. Second one is basal layer remain attached with the basement membrane, and it is known as and it is look like tombstone appearance. And the third one is, there is thin walled bulla. There is thin walled bulla that rupture easily. There is thin walled bulla that rupture easily. Thin walled bulla that rupture easily. That is the high and thin walled bulla that rupture easily. So if you get a bulla that rupture easily, so it is pemphigus vulgaris. And it looks, and in immunofluorescence it looks like fish net appearance. It looks like fish net appearance. This is the bulla which doesn't rupture easily, that is bullous pemphigoid. In here there is autoimmune destruction of the hemidesmosome. There is autoimmune destruction of the hemidesmosome between the basal cell and the underlying basal membrane. Autoimmune destruction of the autoimmune destruction of the desmosomes. And it's a tight, tough bulla. It doesn't rupture easily. Tense bulla that doesn't rupture easily. And in here there is IgG antibody against the basement membrane collagen. IgG antibody against the basement membrane collagen. On the other hand, in pemphigus vulgaris there is IgG antibody against the desmoglein, but in here there is basement membrane collagen. IgG antibody against the basement membrane collagen. In here oral mucosa is spared. This is another important point, that oral mucosa is spared. And the first picture about the pemphigus vulgaris, in their oral mucosa is involved. Oral mucosa is involved. And in immunofluorescence you will get linear pattern. Immunofluorescence you will get linear. In immunofluorescence you will get a linear pattern. This is dermis, this is epidermis, this is the blister, and in here there is no tombstone appearance. There is IgG antibody against the basement membrane. This is the basement membrane, so IgG antibody against the basement membrane, and that is all about bullous pemphigoid. And this is a picture of dermatitis herpetiformis. This is autoimmune deposition of IgA. At the tip of the dermal papilla. At the tip of dermal papilla. At the tip of dermal papilla. Autoimmune at the tip of dermal papilla, and it is strongly associated with celiac disease. It resolves with gluten-free diet. And the next one is erythema multiforme. Erythema multiforme. It's a hypersensitivity reaction characterized by targetoid rash with bulla. This is like targetoid rash with bulla. This targeted appearance is due to central epidermal necrosis. This targeted lesion is due to central epidermal necrosis. This is due to central epidermal. This is due to central epidermal necrosis. This is due to central epidermal necrosis surrounding with erythema. It is most commonly associated with HSV, mycoplasma. HSV, it is strongly associated with HSV, mycoplasma, drugs, HSV, mycoplasma, drugs like penicillin and sulfonamide. And there is autoimmune disease and malignancy. There are some autoimmune disease and malignancy. There are some autoimmune disease like SLE and malignancy. And erythema multiforme with oral mucosal lip involvement and fever is termed as Stevens-Johnson syndrome. In Stevens-Johnson syndrome, erythema multiforme plus mucosal involvement plus fever. That means if you get Stevens-Johnson syndrome, that means erythema multiforme plus oral mucosal involvement plus fever. In 10, toxic epidermal necrolysis is a kind of Stevens-Johnson syndrome. It's kind of Stevens-Johnson syndrome, but in both cases, Stevens-Johnson syndrome, toxic epidermal necrolysis, in both cases you will get Mikulski sign positive, Mikulski sign positive. That means one single skin pressure will slough up the skin. Then I would like to talk about some tumors. First of all, I would like to talk about this. This is the picture of seborrheic keratosis. This is benign squamous proliferation. Benign squamous proliferation. This is raised, discolored black. Raised, discolored black. This is waxy and looks like stuck on. This is waxy, stuck on appearance. Stuck on appearance. It is characterized by keratin pseudocyst. It is characterized by keratin pseudocyst. It is characterized by keratin pseudocyst. It is stuck on appearance. This is the picture of seborrheic keratosis. And in here there is keratin pseudocytes on histology. This is the picture of lesser trellet sign. This is the picture of lesser trellet sign. This is the picture of lesser trellet sign. If you get multiple seborrheic keratosis, that means the lesser trellet sign is sudden onset of multiple seborrheic keratosis. And if you get this type of feature, you have to look for underlying carcinoma of GI tract, carcinoma of the GI tract. This is the picture of acanthosis nigricans, that means epidermal hyperplasia with darkening of the skin. This is velvet like. This is velvet like. This is velvet like skin, often involves axilla and groin, and it is associated with non-insulin dependent diabetes mellitus and GI carcinoma. This is velvet light. This is acanthosis nigricans. It is associated with non-insulin dependent diabetes mellitus and gastric carcinoma. This is the picture of this is the picture of this is the picture of basal this is the picture of basal cell carcinoma In basal cell carcinoma, there is malignant proliferation of the basal cells of the epidermis. Here, there is malignant proliferation of the basal cell of the epidermis. The risk factors are from UVB-associated DNA damage. If you can basal cell carcinoma, you can easily remember that sunlight, the associated factor is sunlight, albinism, and I have make you see in this picture that xeroderma. These three cause is important: xeroderma, sunlight, albinism, and xeroderma. Xeroderma pigmentosa. We know that sunlight will when sunlight falls into our skin, it will make pyrimidine dimer, and this pyrimidine dimer is removed by an enzyme called excision endonuclease. If there is deficiency of this excision endonuclease enzyme, it will cause a disease called xeroderma pigmentosa. And it is present as elevated nodule with a central ulcerated crater surrounded by central ulcerated crater surrounded by dilated telangiectasia tissue. It's a pink pearl pearl button. Basal cell carcinoma, basal cell is usually upper lip, and squamous cell carcinoma usually in the lower lip. In basal cell carcinoma, you have to do surgical resection, and in basal cell carcinoma there is in histology you will get a peripheral pseudopalisading. Nodules with peripheral pseudopalisading is seen in basal cell carcinoma. Now this is the picture of squamous cell carcinoma. This is the picture of squamous cell carcinoma. This is the malignant proliferation of the squamous cell. The associated symptoms are that three. That means sunlight, albinism, and xeroderma. There are some other association that is immunosuppressive therapy, arsenic exposure, chronic inflammation. It presents as ulcerated nodular mass. Especially on the face, and it usually seen in the lower lip. So carcinoma in the lower lip, then you have to think about squamous cell carcinoma. If you get the upper lip, then it is basal cell carcinoma. And treatment is surgical excision. In here, treatment is surgical excision, and metastasis is uncommon. It presents as ulcerated nodular mass, especially on the face. And there are some other things you have to remember, that actinic keratosis is a precursor lesion of the squamous cell carcinoma, and it presents as hyperkeratotic scaly plaques often in the face, back, and neck. And keratoacanthoma is a well-differentiated squamous cell carcinoma. In squamous cell carcinoma, you will get is actinic keratosis. That means in actinic keratosis there is hyperkeratotic scaly plaque, and keratoacanthoma it presents as cup-shaped tumor filled with keratin debris. It is present as cup-shaped tumor filled with keratin debris. And then the other thing you have to remember that, first of all, vitiligo. In melanocytes are responsible. We know that melanocytes are responsible for skin pigmentation, and it presents in the basal layer of the epidermis. And melanocyte is derived from neural crest, and melanocyte synthesize melanin by using tyrosine. Melanocyte by using tyrosine as a precursor molecule, and it passed melanosome to the keratinocyte. Vitiligo means it's a localized loss of this is the localized only in the hand. This is dark pigmentation. This is pigmentation. This is depigmentation. Suppose this is a dark, this person is dark complexion person, so this is the pigmented area and this is the depigmented area, and it is localized collection and the localized loss of skin pigmentation due to autoimmune destruction. In here there is autoimmune destruction of the melanocyte. In here autoimmune destruction of the melanocyte, autoimmune destruction of melanocyte. But in albinism, there is congenital lack of that tyrosinase enzyme. So tyrosine cannot be converted into melanin. So there is impairment of melanin production, and it may lead to squamous cell carcinoma, basal cell carcinoma, melanoma, to reduce protection against UVB. So in albinism, there is a chance of developing basal cell carcinoma, squamous cell carcinoma, and melanoma. Then freckles. Freckles is small tan to brown macules. Small tan to brown macules. It happens due to increased number of melanosome. And melasma usually seen in pregnancy and oral contraceptive taking people. It's a mask-like hyperpigmentation. It's a mask-like hyperpigmentation. Now, this is the picture of congenital nevus. In congenital nevus, it is benign or malignant. This is benign. How I have said that this is benign? Because in here there is hair follicles are still intact. In a carcinomatous area, it is not possible to survive a survive a hair follicle like this. So it is benign congenital nevus, and acquired nevus arise in the later in the life. Benign as nest of the melanocyte at the dermoepidermal junction, most common in children. It grows by extension into the dermis. And junctional component is eventually lost in the intradermal nevus, which is the most common mode in adult. And dysplasia may arise, which is the precursor to melanoma. If the mole on nevus is dysplastic nevus, it can progress to formation of melanoma, which is a skin cancer. Okay, this is the picture of melanoma. This is the picture of melanoma. In melanoma, there is malignant neoplasm of the melanocyte, most common cause of death from cancer. It's the most common cause of death from cancer. Its risk factors are based on UV-induced DNA damage, including exposure to sunlight, albinism, and again the xeroderma pigmentosa. An additional risk factor is dysplastic nevus syndrome and presence of mole-like growth with avicity. That means asymmetry. Border irregular, color is uniform, color is not uniform. Sorry, this is the picture. This is the picture of squamous cell carcinoma. Sorry, this is the picture of melanoma. In here there is asymmetric color, diameter is more than 6 cm, borders are irregular. It is characterized by radial growth. Suppose this is dermis, this is epidermis. If it is growth radially, If it is growth radially, if it is growth horizontally along the epidermis and the superficial dermis, there is low risk of metastasis. Low risk of metastasis. If the vertical growth and it can involve the dermis, then there is increased risk of having metastasis. Increased risk of having metastasis. And there are some variants. There are some variants of melanoma, and that is superficial spreading. In superficial spreading, this is the most common, and in here there is a dominant early radial growth. This is dominant early radial growth, which is called superficial spreading. Then lentigo maligna. In lentigo maligna there is again a radial growth. Then the dermoepidermal junction. Lentigo maligna is a lentiginous proliferation in the dermoepidermal junction. Now nodular. Nodular is early vertical growth. Nodular is early vertical growth, and acral lentiginous is arising in the palms and sole. Acral lentiginous arises in the palms and the soles, often in dark skin individual. And now some other disease, impetigo, which is most common in children. Impetigo can happen by staph, and staph it can be separated by a test called catalase. Staph aureus and strep bigens can cause these impetigo. Impetigo is a honey-colored crusted, dry honey-colored crusted lesion. Honey-colored crusted lesion usually in the face. Now, cellulitis. Cellulitis is deeper infection, usually Staph aureus or strep pyogenes, and from cellulitis it can lead to necrotizing fasciitis. Necrotizing fasciitis is a flash-eating necrotizing fasciitis. Usually, its infection is caused by anaerobic flash-eating bacteria, and there is production of carbon dioxide, which can lead to cryptus. And the other picture is SSSS, that Staphylococcus scalded skin syndrome. In Staphylococcus scalded skin syndrome, there is sloughing of the erythromatous. Rash and fever, which leads to significant skin loss. It is due to Staph aureus. And this is the picture of Staphylococcus scalded skin syndrome. This is due to Staph aureus infection. Exfoliating A and B toxin results in epidermal lysis of the stratum granulosum, and distinguish histologically from 10 by the level of the skin separation. Separation of 10 occurs in the dermoepidermal junction. The dermoepidermal junction usually 10 occurs, but stratum granulosum layer is involved in Staphylococcus scalded skin syndrome. Now this is a picture of verruca or bud. It's a yellowish colored capsule with a rough surface. It is due to HPV. And in here, as a treatment, you can give sialic acid. And finally, molluscum contagiosum. In molluscum contagiosum, it is molluscum contagiosum is a pox family infection. And in here, you will get cytoplasmic inclusion, molluscum body, and that's all about skin pathology. Inshallah, you will be benefited.